Hello, everyone. I'm Dr. Diana Bitner with True Women's Health, and we're here tonight for our series of Let's Chat about surviving cancer and living well with Tammy Myers, special guest. So I'm very honored to welcome Tammy tonight. Thank you, Tammy, so much for being with us.
Oh, of course. Thank you for asking.
Of course. So very briefly, first of all, some bookkeeping. Number one, this light is not great tonight, sorry, is number one, our next Let's Chat is about Game Changer, when menopause happens early. So we're going to be talking with Suzanne Pettigrew, our PA at True Women's Health, about what to do about menopause that comes early. So looking forward to that conversation. Also, we're very proud to announce that our ebook on seeds is now up on the website for free download. It's the book about those 7 essential elements that I talk about all the time here when we talk about Let's Chat or in our True Women's Health Clinic or on our website. So feel free to go to the website, truewomenshealth.com, and download that free ebook on seeds. But I really want to get to what we're talking about here tonight. We're talking about surviving cancer and living well. And as I always like to start out, I want to talk about why I care about this. And Tammy will share the same. And then Tammy are going to have a conversation about what this looks like and about her experience. And then we're going to end up, as we always do, with 5 tips for people listening, as well as 5 things that women can ask their healthcare providers to make sure they get the care that they deserve. And so to start off, I'd like to talk about why I care about this. Number one, so many women are getting cancer, and then luckily we are having great new treatment options, and many women are surviving cancer. But then as that last appointment happens and they say, you're good to go, we'll see you in a year, people are left with what's next, and that needs to stop. For women who are like Tammy, I want women to have hope that there is good survival after cancer. For people watching this, I want people to understand not only what people like Tammy go through in terms of having more empathy and being able to better support people in our community, but also for you, for whatever health challenge you might be facing, how do we live with a chronic illness, and how do we live with a diagnosis such as cancer? And for people watching who are healthcare providers, how can you be more empathetic to what women go through in terms of how can we better support women who deal with any chronic illness, especially a diagnosis of cancer? So having said my why, Tammy, I'm very curious. Again, thank you so much for joining us. Why are you here? You've taken time out from your family, from your daughter and your husband, and after a long, busy work day to join us tonight. Why are you here?
Oh, gosh. So for me, 5 years ago before my diagnosis, I was very not likely to do something like this. But going through the process myself, I realized how isolating it is and how lonely you feel because nobody really understands until they've gone through it themselves. So for me, it's important that I do my part in sharing my own experience so that people that are going through a cancer diagnosis at a young age, especially, know that they're not alone.
Well, it's such a gift, and I'm just so thankful because, and even as a doctor, as an OBGYN, and taking care of women for over 25 years before I even thought about the topic of cancer survivorship, I had no idea what women were living with. And, I'm so grateful that you and patients like you have taught me what it is that women deal with and how we can better support.
Oh, yes. No, that's helpful too. I know it's hard because when you're going through the thick of it, that's really when you can make the biggest impact. So
Exactly.
I found that sharing my own story not only helped people who were following it, but it also helped me. So I think it works both sides.
Sure. And can you tell me, what does it mean to be a cancer survivor? What does that feel like? What does that mean to you?
That's a tough one for me, actually. I struggle a little bit with the word survivor, mainly because I've lost a lot of friends to this awful disease. But at the same time, I've been through the thick of it. I'm really thankful to be here. I'm really thankful that my daughter still has a mom. I also feel like I have I owe it to the people who I've lost to carry on and keep advocating for young women.
I just got shivers. I mean, I can't imagine. And would you say, when you think about how cancer might have changed you, how do you think about that in terms of how cancer has changed you, has changed your family?
Oh my gosh. So that's a hard one. That's hard to put into words, but like I said, I'm a completely different person. I know to the core, I am who I've always been.
Of
But I
course.
think before cancer, I was a little more timid and shy. And although I had great aspirations and, having purpose was huge for me, I wasn't brave or bold enough to act on it. So I would dream about the things that I could do. And now post cancer, I feel like I have the guts to do it and seize the opportunity. So just like accepting tonight, maybe it pushes me out of my comfort zone, but I also just go for it now. I say yes.
Well, I respect you very much for joining because it's not always the easiest thing, even in terms of even sharing personal details, but to talk about something that's so raw. But I think, like you and I have talked about, once we're out here talking and it just starts, it's like it flows, and it's so. I think we're so lucky to be in a position where we can shed light on this. What would you say some of the hardest challenges have been? Maybe initially, and then as you've gone through this journey.
Um, Initially it hits you like a Mack truck. I was young. I was 33. I had none of the risk factors. I didn't see it coming. We were, somewhat newlyweds. A few years into our marriage, we had a 2-year-old. We were renovating a house. All things were happening life wise, and then cancer happened. So it flips everything upside down, and you have really no time to digest. You just kind of go on autopilot. So the hardest part, it was hard to be young. It was hard to be in that setting, and one of the only people that were my age. So there aren't a lot of people that I could commiserate with or even talk with.
Sure.
But the hardest part has been the fear. Initially, I remember the first thing I said to my oncologist, which was Dr. Melnick, was, "How long do I have?" I thought it was right away, like, do I have months? Do I have years? How does this work? And the next question was, can I continue building my family? So I was trying for number two. We had one, we were trying for number two. And she right away said no. so those were the hardest things for me. I think just questioning my own mortality, not knowing if I would be here to raise my babies,
Yeah.
or not knowing if I could have any more babies.
Sure. I guess, could I ask you a detail, like how did you find out that you had breast cancer?
So for me, I actually found the lump myself. So obviously at 33, there's no screening, there's no mammograms. And I, at the time, didn't have a family history. I was a lone ranger in that department. I did have one aunt who
Mhm.
was married into the family, so not a blood relative, but she was diagnosed in her 30s. And she was, kind of my mentor as a kid, somebody that I really looked up to.
Yeah.
And she went in with a lump herself. And at the time, this was 20 years ago, and at the time they said, "You're too young," and sent her home. I believe she was 36, 35. And she kept on it. And by the time, after I think 3 or 4 appointments, they finally gave her the time of day, and it was stage 4. So we lost her within, I would say, a year to 2 years. She left a couple of small children, my cousins,
Oh, I'm so
and
sorry.
it impacted me hugely. And at the time, I made some promises to myself that, I was going to fight for this. And I would, for her, never knowing that it would be a part of my own life or my own journey.
Sure.
And
And I guess, sorry, go ahead.
no, go ahead. But
Well,
because
one
of
of the
that,
points that I wanted to bring up is that sometimes, I don't think we emphasize enough the importance of self breast exam. And I think that, unfortunately, there are guidelines in the National Health Task Force that say self-breast exams aren't important, and I just couldn't disagree more. We know the majority of women who are under 45 who have breast cancer, the majority of women find it themselves.
Mhm.
And, as a doctor, I would say you might, not know what something is when you feel it. All I care about is that if you feel something that's different, it's my job to take it from there. And it's my job to figure out what it is. If it's just a cyst that should go away, if it's not, that's my job. Your job is to tell me if something is different. So I just applaud you for following up on that. And I encourage all people listening, male or female, to do a regular self-breast exam.
Yeah, that is how I found it. I was laying in bed, and like I said with my aunt, she found it, and knowing that it happened at a young age for her, it pushed me. I mean, I'll be honest and say I
Of
found it
course.
and hesitated. I waited probably 2 weeks before I even told my husband.
Sure.
But the more research I did and the more I thought about it, I just had a feeling in my gut and had to make the call.
Wow. I mean, that just gives me shivers too. But in terms of the challenges, as time goes on, what would you say some of the positives are? You said that you've gotten bolder and more brave, and, you've learned to speak up for yourself and to speak up for other people. What other positives have come out of this?
Oh my gosh, I would say perspective. So, for me, before cancer, you kind of live carefree. You're not worried about the little things. You're not worried about your life at that point, especially in your 30s. You're just kind of rolling through it. But when something like cancer happens, you're forced to take in the little moments. You see the value in every day completely. And, to that note, you're also, I don't know. I feel like it's made me embrace the little things. It's given me perspective. It's taught me really what I want,
Mhm.
and I'm not afraid to say it or do it.
Yes, no, you're not. I'm very proud of that. But I think that's, again, one of the ways that women cope is, well, there's three main things that women do who cope well. Number one, they believe they deserve to be happy. And I think that's something of you that's never changed, is that, and maybe now, in terms of how you think about your experience from your aunt, you believe that you deserve to be happy, and you believe that you deserve, okay, to be happy. And number two is that you keep a support network around you, right? Your husband, your friends, your medical care team, your colleagues, you keep
I
people
do.
around you, right?
And it's important who those people are. I feel like I surround myself with people who build me up now. I have less patience for people who tear me down. It's made a huge difference in that department.
And don't you think it's really important to keep that network around? Like, it doesn't just happen. We can't take, people for granted. And when they're having a bad day, we can support them. But also, I remember what my mom used to say: "You're not going to get a letter if you don't write a letter." So we definitely have to support those around us. But then it's also okay. Then the third thing that women do cope is they ask for help when they need it. And
Oh,
that's one thing I think you've shared with me, you've learned, is you ask for help when you need it, and you reach out. And
I
maybe
do.
before
I
you
think
wouldn't
I
have.
struggled with that in the beginning. I didn't want to reach out. I didn't want to ask for help. And I didn't even want to talk to anyone who was going through it. I was fearful, but during
Sure,
during the journey, I realized that there's a lot of power in talking to people who get it.
sure.
Even
And would you have even ask your husband for help?
no. No, and I'm pretty stubborn, so there are days
Mhm.
still where I struggle with that, but I know that it's important to do so. I think I'm more apt at this point to
Sure.
raise my hand for sure.
So how do you think this has affected your relationship? I mean,
With my
that's a big question, right? But
husband?
how has this affected your marriage?
Oh, that's a tough one too. So for us, we went, I think what people think, or assume when you're going through cancer is that your relationships are going to be stronger because you both look at the situation and you know that, every day isn't a guarantee. So
Mhm.
you should embrace that. But honestly, I have found with me, like my husband and I, we struggled through cancer. We struggled through those first 6 months, that first year, and we still struggle now. We're kind of working through it, but communication, I think, was hard at first, where I was trying to be super optimistic because I needed to be. I didn't have a choice.
Hmm.
His world just had come crashing down. He was
Sure.
fearful that he was going to lose me. He was fearful that he was going to be a single dad. He was hurting as much as I was. And at the same time, the focus is taken off of the spouse because everybody is worried about the patient. Everybody was worried about me. So, it was hard for me at the time, but it was also hard for him. I
Right,
think,
exactly. And like, I would imagine he, like most people in that situation, don't want to say, "Hey, what about me?" Because that would sound
no, they can't.
selfish, or yeah, they can't. But yet there is so much going on, and it's like it's supporting the caregiver, be it a caregiver for someone with Alzheimer's, or be it a caregiver for anyone with a chronic illness. It's also making sure that we're taking care of the caregiver, not only for the selfish reason of getting better care for the person who's ill, but also for their mental health as well. They matter too. They're part of the equation.
And they do. It's huge, and I've had to learn a lot about that because in the beginning it was hard that he wasn't able to support me. I in our relationship, there's always someone who's the strong one, and that was always me in our relationship. Nothing had ever broke me, and it took a while. I would say I was completely optimistic until mid chemo. It hit me that I was super sick. I couldn't really do all of the things. I couldn't mind over matter cancer as much as I thought that I would be able to, or as much as I had been able to do in the
Hmm.
past. And
Sure.
um, I needed him to stand up and support me, and he didn't really know how to. So I think it was a huge learning process. And
Sure.
now that I've gotten through those really hard days, I look back and I see the positives and the things that he did to support me along the way. But I'd be lying if I said we didn't have struggles.
Well, I found this quote as we were getting ready to go on tonight, and I just love it. It's on the Huffington page, but it's by Christopher Reeve, and the quote is: "A hero is an ordinary individual who finds the strength to persevere and endure in spite of overwhelming obstacles." A hero. And so, in that, not only are you the hero, but your husband is the hero. And Corinne, is just, it's like figuring out how to get through these obstacles, no matter how big they seem.
Oh, completely. I feel that for sure. One thing that I've always said is cancer doesn't just affect the patient; it affects every single person that loves that patient. So my husband became my hero. My daughter became my hero. I mean, she was driving force through the whole thing.
Right, right. And then in terms of just how, he has stepped up and you have allowed him to do that, right? So it's really, I think it's kind of cool to see how you really have, because when things become hard, right? It shows maybe vulnerability in the relationship that you never would have experienced. You kind of go through life and then all of a sudden, you're 50 and the kids are off to college and you're like, I would argue that I wonder that you guys will be even closer at 50 than you would have been.
Oh, yes. We actually had a nurse, my nurse Shay, who said to us, and we were pretty open during my cancer journey, but she became uh, my everything. She supported me through the entire thing, and I shared with her the struggles that I was having with my husband. And we even talked together with her one day during probably one of my chemos,
Of
or
course, because you're
or
sitting there.
well, we were sitting there and she said, cancer has the ability to make or break your relationship. And it all depends on, what you want it to do. And in the beginning, it felt like it was going to break us. And I feel like that conversation and just realizing the power that it had is really what helped us.
Wow, what a gift. Because, as I've gotten the honor of taking care of women who have gone through cancer, I really have been surprised at how many women their relationships don't survive their cancer
Mhm.
diagnosis. And because again, it shows maybe cracks that were already there and it makes them bigger.
It does. Oh, completely.
So is there anything that you feel could have been done better, differently, that could have been there for you initially so you didn't have to maybe suffer as much? Or do you feel like that was part of the journey that had to happen no matter what? I don't know how else to ask that. It's like what could we have done, but it's still your process, right?
Yeah. Yeah. Honestly, I don't have a lot of complaints with my process. I feel like my medical team was amazing. I feel like they were on it. They moved quickly. They didn't waste any time. And I also felt really supported by my team and the community. But I hear from a lot of other women that it doesn't move quickly, and there's a lot of waiting in the beginning stages when we should be
Hmm.
acting and fighting the cancer. Um, I think for me specifically, and this may have just been part of my journey, is I didn't realize how much it would help to connect with other women my age who were struggling with the same things. And I didn't know that there was a community out there that I could connect with. So, knowing that firsthand, maybe having a mentor, I
Yeah.
see Liz, who's watching right now. Hi, Liz. She became my mentor, and she met me early on and guided me through those very scary days. But that was by chance. I think if that was facilitated in the beginning, that would have helped me for sure.
Well, and that's one thing I want to do more and more with True and at True Women's Health is, we're soon launching our cancer wellness program, but I just hate it when I see a woman who has anal cancer or colon cancer or uterine cancer, cervix cancer, breast cancer, and says, I feel so alone. And I'll say to her, I've seen 3 people like you today. And so, it's more and more, how do we get people together with a shared experience so we can offer support to the community and offer options? And it's to say, well, what did you do about that? Well, I did this. Well, I did that. Well, this, I heard about this. And so I think, more and more we need to standardize what is available for people, but especially to create that community to allow for that free conversation.
Yeah, I think so too. Honestly, it takes a patient like myself who's willing to put herself out there and be a little vulnerable. But I know that my oncologist has reached out and asked if she could connect me with newly diagnosed patients. And I
Mhm.
feel like that would have been huge for me going into it.
I get it. And tell me about a bit about, the whole menopause thing. As you know, I specialize in midlife and menopause because I saw so many women struggling with this. And, how I got involved with women who have had cancer is as I developed the midlife and menopause program in West Michigan, I was kind of the only game in town in terms of a doctor who specialized in that. And so the oncologist started calling me and saying, would you see our patients who have menopause symptoms and they're 38, they're 40? And I'd be like, well, why? What do you mean? Well, they've had cancer, they've had chemotherapy, they've had surgery that caused premature menopause. We don't know where else to send them. And so as I started meeting women who have gone through this, again, so honored to be able to offer safe solutions. I've learned so much. Um, how is that for you, and what could we have done different in terms of even telling you what was going to happen?
Oh, so for me, honestly, I mean, you're just hit with the news that you have cancer. I mean, that's life altering in itself. And really, you can't focus on anything else. And then your doctor kind of slides in, and by the way, we're going to have to put you in menopause. And you just kind of, or from my standpoint, I just kind of went like, oh, okay,
Okay.
hot flashes. I can deal with hot flashes. That's minor. And you dismiss it, or I dismissed it. And I was, so wrapped up in everything else that was cancer at the time that I didn't really prepare myself for the life change that was about to happen when I was put in menopause. I mean, I had no idea.
Right.
And I know it's a little bit different and it depends on everybody's treatment path, but for me, it started the first day of my chemo.
Sure.
Before they started the chemo medication and hooked up the IVs, they gave me an injection that would immediately put me into menopause. So right off the bat, I was feeling the after effects of chemo and menopause day one.
Day one. And I think sometimes, there's a crossover of those symptoms. And, we also just put on the website the MTS, or the menopause transition scale. So women can actually rate their symptoms in a very objective way to say maybe what's menopause transition versus what's something else. And so women can just go on, it's 7 questions, it's a 3 or a 2 or a 1. And I think that's been something really helpful that I've seen help women understand what their symptoms are, and then maybe track it over time when we look at different things to help them feel better.
Yeah, I mean, that's huge for me. Like you said, I couldn't really decipher between what was from the chemo and what was from being put in menopause initially. But now that some time has passed and I'm no longer in active treatment, I know what those symptoms are.
Right. And including, what at True we talk about a lot, but just even in terms of sexual health, like, how that impacts pain and desire, and especially as a young couple, that must have been impactful, um, to have those kind of symptoms change.
It is.
So it looks like Tammy's frozen for a second. So, sexual health is a really big deal, but also is the hot flashes, the night sweats, the weight gain that might happen from menopause. And that's something that women will feel, for example, with cancer and chemotherapy, that, weight loss will continue to happen, and there might be a struggle to not lose weight. But unfortunately, then for many women, because of the menopause side effects after cancer, then what happens is that there's weight gain. And so what menopause does is makes us insulin resistant. It makes our fat cells crave sugar. They tell our body to eat sugar. And if we eat sugar, even white flour, white rice, then what happens is that those calories go straight into belly fat. And so unfortunately, one of the things that people suffer from is weight gain that doesn't make sense related to menopause. So it's, hopefully we're going to get Tammy back. But in the meantime, why don't we move forward and talk about 5 tips? So 5 tips that we think about in terms of what women can think about that are going through this process, and/or, those of you out there who take care of women who have gone through cancer or chronic illness. What are 5 tips for cancer survivors? And the first tip that I would give women, and I know Tammy would say the same thing, is don't be shy, speak up. Often, again, the team that's taking care of you during a cancer journey, treating your cancer, hopefully curing this cancer for you, is, again, they're so focused on treating the cancer, making sure the side effects of the chemotherapy are managed well, that you're doing okay, that you're not suffering too much from this. So they're very focused on the treatment of the cancer, but they might not have the bandwidth, the time, the energy to talk about those symptoms that you're not bringing up. Again, it's not just enough to have survived cancer. You deserve to thrive. We worry about women who feel guilty of, I should just feel happy that I've survived. I shouldn't, complain about being tired. I shouldn't complain about low sex drive. So again, tip number 1, don't be shy, speak up for what's bugging you, and make sure that you get connected to someone who can help. Okay, tip number 2, allow people to support you. You don't have to do it all alone. This is something that I hear frequently from women who go through a cancer diagnosis, go through treatment, is that they feel like, I should just be able to do this on my own. I should be able to take care of this. They're making dinner when they're feeling sick after chemotherapy. They're worried about, things that they normally would want to do. And some of that, of course, is important if you can do it and it helps you feel normal. But again, if you need to rest, you need to take care of yourself. It's okay to ask for help. And for many women, again, thank goodness, because of great treatment options, for many women, the cancer is temporary, in the sense that there will be a time where you can do everything for everybody again that you've always wanted to do. But especially during treatment, it's okay to have a bad day. There's a new song out right now by Demi Lovato that's "It's okay to have a bad day." And sometimes it's just okay to have a bad day. It's okay to stay in bed. It's okay to make a cup of tea and read a book. It's okay to ask for help. You don't have to do it all by yourself. Okay, tip number 3 is spend time visualizing yourself as strong and healthy. I love reading from Dr. Andrew Weil about, the father of functional medicine, and Dr. Benson, who wrote Relaxation and Response. These are books that talk about the power of visualization, the power of positive thinking. We know, for example, that gratitude can strengthen our immune system. We know that with the power of our mind, we can lower our heart rate, we can lower our blood pressure. Our mind and our body are not separate entities They are strong together. And so just having that vision, that knowledge, that dream that everything's going to be okay is really important in terms of our body believing that. Fear is not good for us. Fear is not good for the healing process that happens with any chronic illness, and especially the recovery from cancer. I love how Dr. Weil talks about medicine, let's say for chemotherapy. Chemotherapy treats the cancer, it kills the cancer cells. But then we have to support the body to allow the body to heal. And we do that with visualization, we do that with meditation, and we do that with really good nutrition. So again, we use the medicine to treat the problem, to treat the cancer. We use our own body and our strength and our healthy lifestyle, like we list in the seeds, to really support our body to heal. And so I would ask, as you're going through this journey, what is your picture of self? How do you picture yourself at a milestone event? So maybe for Tammy, it was Corinne's 5th birthday. It was that day that when she can say, okay, I've survived cancer. Hey, Tammy.
I'm so sorry.
It's all good. It happens. So in this new age of Zoom,
Comcast.
I'm talking about like in your power picture of self, like the power of visualizing that. So as you were going through chemotherapy, when you were going through, maybe really having some bad days, what was your picture of self? How did you think about yourself in the future?
I think that's tied to my daughter for sure. I thought about being here for her for future more than my own.
Mm-hmm. Yeah, and don't you think, like, how do you think that helped you? Like when like maybe describe what does that feel like? What do you think the power of that was?
Oh, it's huge. I was ready to get up and fight and put those boxing gloves on every day because the thought of not being here for her or having to tell her goodbye, uh, it wasn't something I was willing to accept.
Mm-mm. And I remember, when I first met you, is asking you, what do you want? Right? What do you want? What do you want your future to look like? And, you know, and that's what I wanted to do. I wanted to do everything I could to help you get to that place.
You have, honestly, I mean, it was survival from the beginning.
We look so young.
We do. That's 5 years ago.
Wow, that's crazy. And who would have imagined we are where we are? And did you ever picture yourself having more than one child, if I may bring up this subject?
Oh my gosh. Well, I think I mentioned we were trying for number 2 when I found the lump. So I had always envisioned at least 2. But I didn't know if it would happen after I was put in menopause. And I actually had an ovarectomy about 3 months after I ended treatment. So it was full-time menopause. But I thankfully was told early on, thankfully, I knew my options. So it was very expensive and super stressful to make the decision over a weekend. But we did make the tough decision to harvest my eggs and store them just in case I
Which is
survived.
such a gift. Yes, and so many women don't know that that's an option. And,
No.
it's wonderful that Spectrum Health has a program that we call the Adolescent Young Adult. And I was honored to be involved in the start of that program, to where we offer those services that women can have the option of freezing their eggs, freezing an egg, mixing it with a sperm if they already have a man in their life to be a father, that then they can freeze an embryo. And so that's so important that women know that's an option. So Tammy, you're saying you froze eggs. What happened then?
We did. So it had to happen really quickly because they have to do it before chemo. So we went through with it. It started the day I got out of my bilateral mastectomy. And, then you kind of just set it aside and forget about it. 5 years have passed and we've been, trying to get under the burden of medical debt and all of the things. And, but we knew we wanted to do it. So knowing the clock was ticking, we actually just started the process this fall, or this past fall. So it's been like 8-9 months. And we were actually awarded a grant to help with some of the financial side of that from SAM Fund. And in January to February, we moved forward. We found a carrier, so it's a gestational carrier to use.
A woman who's generous enough to share her uterus.
Yes, especially in Michigan with the laws, it's so complicated. And we had some hiccups, and COVID kind of screwed everything up, and we lost our original carrier. But now we have a new carrier, and she signed up willingly. There's no gain for her, and she just wants to help someone have a baby who cannot. And as of this summer, we actually moved forward. We did a transfer, and we are pregnant with twins. We actually just found out this weekend. Yes, there's the photo. We just found out that we are having a boy and a girl. So we're super excited. It's been quite the journey, and something we never thought. We really didn't have a lot of hope that it would come true for us. So the last few months have been amazing.
That's great. And I know Corinne's so happy, and I know your husband's so
she's so happy.
Children. So this is such a blessing. Such a blessing.
Yes, we're excited. So I think it's important, that young women who are newly diagnosed know that this is out there, or even young men, you can preserve your fertility.
Exactly. And it can even happen after a round of chemo now. There's more data that even after a round or two, that it still could be possible to preserve eggs. So again, what's so lovely is more and more people are talking about this. The techniques have been more perfected. It can be expensive. There are grants available. And so a lot is definitely being done in this. So again, to get to picture of self and the power of that, again, you were able to picture yourself in your mind, still here for Corinne, still here for your family. And so I just encourage people to always have that. I have it for my personal life, how I will be in the near future. And we at True, we ask people that every day. What do you want to be? How do you want to be? And then how can we support that? So tip number 4 is to have a daily practice of relaxation or metered breathing and gratitude. And again, we know that women who have a daily gratitude practice, not only do they sleep better, do they cope with stress better, but it takes practice, right, Tammy? It's not something that just happens.
No, I still have to practice. I'm 5 years in.
And right there with you, it's having that even every night before you go to bed. One option is to have a gratitude journal. And when you wake up in the middle of the night and the mind is racing, it's to get up, go to the bathroom, drink some water, and then just sit for a minute and just think about what you're so grateful for. And then hopefully your mind settles, go back to bed, and you're out. So important to have this daily practice. And it's that, right? It's to practice. Tip number 5. You want to talk about this?
Oh, man. I can, yes. So suffering in silence is something I did for a long time. But reaching out to Dr. Bitner I've come a long way. I'm still working on it. We have our journal, and she's my mentor along the way. But yeah, don't suffer in silence. Raise your hand and ask for support.
And there are treatment options. At our next Let's Chat with Suzanne, we're going to talk about treatment options, especially for premature menopause, but menopause at any age. And one thing that I'm so glad to offer at True is the Mona Lisa Touch. The Mona Lisa Touch is a laser for treatment of painful intercourse after menopause. It's not better than estrogen, but it's as good as estrogen. So for women who choose not to take estrogen or can't take estrogen because of their cancer diagnosis, the Mona Lisa Touch is an option that we can do that's safe and effective. And, now I've read the data. We purchased the laser. I learned how to use it. I have a wonderful mentor in Dr. Sophocles in New Jersey. She's been on with me in the past. But now that actually I've treated patients with it, I'm blown away. It works. So I just say to women, do not suffer in silence. There are options.
Yes, I'll second that. And honestly, it's something that I have not talked about at all along the way. But, we had trouble there. And my doctor wasn't super excited about the estrogen thing with my positive, hormone positive cancer. We did eventually try it, but, there's some drawbacks to it. It's kind of messy. So recently, I actually started the Mona Lisa therapy, and I've seen benefits already. So I think it's a good option.
Good. Yeah, there are options. And for women with mild symptoms, sometimes just a moisturizer or lubrication works, but for moderate to severe, a lube does not work. So it's again good to ask, what are the treatment options? So what I like to then talk about next is what are questions that women can ask their healthcare provider. Again, we don't want you to suffer in silence. We want you to bring this up with your healthcare provider. So question number one, am I in menopause? So many women don't even know this. They don't talk about it. Again, their team is focused on curing the cancer. What does this mean for me? Tammy, I know they told you menopause, but were you told much about what that even meant?
No, I mean, I knew hot flashes, but beyond that, I had no idea. It was kind of a figure it out for yourself kind of thing,
Sure.
until I met you.
And so, and it's what I love about this is that I don't love that people are in menopause. I love that it explains why, right? So it explains not only the hot flashes, the night sweats, it can explain the mood changes. Why am I irritable? Why am I depressed when, my outlook's pretty good right now, but why do I still want to just stare at the wall? Why is my bladder urgy? Why do I have bladder infections? And so there's, why am I not sleeping or
Yeah.
waking up with night
Yes.
sweats, right? And
Right.
then weight gain. So weight gain happens with menopause, and most people don't always connect those two things.
No, no. I know when I initially was told that, I was like, "Oh no, I can stop that. It's fine. I'll just, diet constantly." And I kind of put it out of my mind, but I remember you saying, "Well, after a year, it starts taking effect." But I'm noticing all of those things. The weight gain is happening. It's a struggle. The thinning hair, that's another one, super struggle. And now all of the things that didn't bother me when I was going through cancer, I could handle being bald then because I had a reason. I could handle, my body being disfigured. All of that was a given, but now the symptoms of menopause are bothering me, like my
Well, and
self-image.
at 38, you're having I mean, all women will experience this at some point, but you're having to experience
Yeah.
this at 38. So, so not fair.
No.
But B, then it's knowing. And so, when you're 30, you can, diet for 2 weeks and get off a couple pounds, right? And
No,
then
it's
it's
not
just
the
a
same
part of menopause.
anymore.
Is not the same. So I think
No.
it's so important that people understand what this means for their health. And so again, there's information on our website, truewomenshealth.com. Menopause.org is the official website of the North American Menopause Society. There's wonderful information. There's a website, isswsh.com, that talks about, it's by our Sexual Health Society. There's information. So it's again really asking the question, am I in menopause and what does that mean? All right, sorry, I go on. So question number two, what are the things I can do to lower my cancer risk going forward? And I
Yeah.
love this question because
Oh,
women
that's
want
a
to know,
beautiful
what can I
one.
do?
Yeah, I mean, we want to do everything. I remember the day my oncologist was like, "Okay, I think we're good. I'll see you in 6 months." And I went, "Wait, no, I need all the things. Give me the guidebook.
Yeah,
Are
what
you
do I
sure we
do?
can meet for lunch?" I'm game. Yes, it
But I
was
think it's all
terrifying.
about,
So
again,
knowing,
yeah, like, again, the chemotherapy treats the cancer, but then how can you allow your body to heal and hopefully reduce the risk of it ever coming back again? And so I think about healthy nutrition and stress management, exercise, good sleep. Is there anything you would add to that you've learned?
oh man, those are the big ones. I know diet and stress are the ones that my oncologist keeps noting for me.
Yes, and one thing that I know, women will talk about, alcohol, the whole concept of alcohol. For so many women, it's just a thing that they take for granted that at the end of a long, stressful day, I'm going to have a glass of wine, I might have two, I deserve it. It's the habit. And what I would argue is we really worry that when women get to more than 7 servings of alcohol a week, it could actually increase the risk of breast cancer starting in the first place, but also increase the risk of recurrence. And so we really encourage women to keep it to 7 or fewer. And then, if you want that second, or even if you can take the first and maybe do this much alcohol and this much club soda, for example. So you still have the glass, the smell, the experience, but you're not getting all that alcohol and all that sugar. So, that's one thing that I want to make sure people know is that, Alcohol really, this isn't an ethical discussion about alcohol. It's the health risk of too much alcohol. Everything
Yeah.
in moderation.
Sugar's a hard one too. That I would think that that's a bigger struggle for me. I mean, first you put me in menopause and I all of a sudden like and crave sugar. And now that's one of the things that could increase my risk. So it's a
Yeah, we know
constant.
that women who carry extra belly fat increases risk. But the other thing that I think about with, lowering your cancer risk, I think, Missy, if you go to question 3, what are the recommendations for follow-up and who is doing what? Oh, let's talk about this and then we'll go back to the other health risks. So this is what, again, I want people to ask their healthcare provider, what are the recommendations for follow-up? And keeping track of what doctor is going to do what. You get so close to your oncology team that you think they're always going to be there doing everything, where they're back taking care of another patient who was just diagnosed. It's like, what's next, right?
Oh yeah, I'm still struggling with that. And I'm really not sure who I should be asking the big questions. So
And again, we really hope to answer that at True with our cancer wellness program in terms of not only treating the symptoms that come after premature menopause, but then also looking at how can we help reduce your risk for cancer recurrence, as well as deal with those health consequences that happen. We know that, for example, cancer treatment and early menopause can increase the risk of osteoporosis or risk for hip fracture, for fragility fracture. So it increases the risk for bone weakness. So it's important that we look at all those factors and then support you with healthy lifestyle. So, to your point, there's such a need.
yeah, it's huge.
So question number 4 is what can I do to reduce the effect of cancer on my long-term health? Do you remember, Tammy, that being part of the conversation, or was that something you were thinking about?
Long-term health? I know in the beginning they did say your treatment is what's going to keep you alive, but it's also going to bring other risk factors later on, like heart disease, and the radiation was going straight through my heart. Yeah, I mean, it's hard because at the time you're not focused on that. You're just trying to stay here. And
Yes.
now I'm focused on that. Like, what did this
Good.
really do? What's coming?
Well, and I so appreciate you saying that, but and yes, I want people, in terms of what is their responsibility, it's asking this question, but then it's my job as the doc to say, this is what could happen, and this is how we're going to reduce the risk of that. So, for example, we know that, again, so many women are surviving breast cancer, but because of the premature menopause, it puts them at risk for a premature heart attack. So everything we do to take care is, how can we know what symptoms are coming, and what signs are coming? So, for example, in a young woman, I might not be too excited about a high cholesterol that's just slightly over, right? But in someone with early menopause and a risk for premature heart attack, oh, we're going to be all over that cholesterol with really
Right.
strong recommendations about diet. We might even recommend a statin earlier. It's about very strict control of that blood pressure and that weight and the blood sugar. Like, again, it's like we're all over that, whereas we might not have been otherwise.
No, I think that's hugely important because, your oncologist is up on it. But like you said, once they check out and you're seeing them once a year, nobody's looking at those little details. And really, even my family practice physician is not looking at everything. So it's nice to know that there's a resource out there with True.
Well, thank you. And again, it's like everyone's very well intentioned, right? And your family practice doctor, that would be so hard. I wouldn't want to be
Yeah,
a family practice doctor, right? They've got to
no,
know
there are
a
so
little bit
many
about
things.
everything. And so we all have to stay in our lanes and really do what we do well and spread the word that there are options. And I would like to think that by being so proactive and preventative, we're going to reduce the risk, because, I want you around for Corinne's babies, so I don't want you to have a heart attack when you're 60. Which is where the numbers would fall if we didn't do anything. So we don't want that heart attack to happen until you're 105. So, that's our job, is to make sure that we're doing everything we can to reduce the effect. And question number 5 is, how do I manage symptoms? So I want people to ask their providers, how do I manage these symptoms? Fatigue, hormone changes, low sex drive. Again, you don't have to suffer. It's not enough to just have survived your cancer. You have to ask questions. And if your provider is not comfortable answering these questions, say, who can I go to? Where can I go for help? Please, provide me with some answers. If you're not comfortable, where do I go? So, I mean, Tammy, that's not really, I guess, in a question, but is that something that, like, would you have thought about that? But again, you're getting on with your life, right?
I am, but it is hugely important right now. I think now that I'm past in the thick of it, this is even more important because now I'm trying to move on and I need to manage these symptoms. And I want to get back to who I was and what my relationship with my husband was before cancer. So, yeah.
Awesome. Well, it's just such an honor to talk about this. If anyone has any questions for myself or Tammy, even after this, or you're watching this not live, please feel free to personal message or private message our Facebook page, True Women's Health. We also have a contact us on truewomenshealth.com. Feel free to leave your questions. I promise that we'll get back to you. And I can find Tammy and ask her a question as well. And
Oh,
she's so generous with her time and energy. And Tammy, this time goes so fast. Is there anything that you want to make sure you share or recommend to people before we go today?
well, I feel really bad that my internet died and you lost that little chunk. So was there anything important that we were just getting to the whole sexual health question and then I dropped off.
So is that so when I've so I guess yeah, let's take a minute to talk about that. Like it's something that years ago I wouldn't have been comfortable asking a patient like yourself because I didn't know what to even talk about. But what I've learned is that women really want us to ask. Yes?
Yeah, we do. Honestly, I was so nervous. It took a long time for me to get the courage to say anything to my oncologist. And at the time, you feel like that's really not a welcome question because, you're fighting for your life. Why are you worried about sex?
Mhm.
So I was embarrassed and ashamed and uncomfortable. And it kept me from asking the question. But once I did, there were resources out there. And my oncologist, I was really lucky. She did connect me with you. And it's opened doors for me now. So I feel like women need to know that there are resources and not to be uncomfortable or shy.
Oh, I love that. And again, it's having that, knowing that there are options. Again, I hate it when women don't talk about this and they feel broken or they feel like there's something wrong with them. And, it really impacts their relationship. And as well, we see that their partners, are really afraid to bring it up, right? Because they don't want to appear again selfish. Like,
No,
well, what about sex? It's not just about the physical act and the pleasure of sex, it's the connection, right?
it
It's
is.
like that's a way that couples stay feeling close.
I learned that with my husband. For me, it was the last thing on my mind and it was painful. So it wasn't something I was looking forward to or
Right.
even top of mind. But in opening up the doors of communication with my husband, for him, he thought he was going to lose me. He thought that, he was going to be alone. So he craved and needed that closeness to help him through my
Sure.
cancer. So I think it's important for both sides.
Oh my gosh, and I so want to emphasize that point because sometimes just being sexual without or being intimate even without, let's say, the actual act of penetrative intercourse. We talk about outer course and versus intercourse, but just having that closeness, again, it's doing something that feels normal when everything else in the world is not normal,
It
right?
is, it is, and that closeness, it's not just sexual, it's the connection, like you said. It's knowing that you're there with someone, that you have your rock, and I feel like that's a huge part of it, and something that I didn't realize in the beginning, and if I'm being completely honest, something we still struggle with, but we at
Sure.
least know the importance.
And two, what I just hate is that, for example, let's say it's a heterosexual couple, and the man is like, I don't want to bring it up because she's going to think I just want to have an orgasm, I just want to have sex, and that sounds really selfish. But again, I just want to hold her, and she might say, well, I don't want to bring it up because I don't even want to bring up cuddling or snuggling or holding hands because if I hold his hand, he's going to think I want sex. And
Yeah.
so, I remember that's just such a common thing. I now just bring it up with people. I'll say to the guy, like, do you even bring it up? Well, no, she'll think I'm just being, selfish and rude and a guy. right? And I'll say to the woman, even sitting right there, I'll say, do you even want to hold his hand? Well, no, he'll think I want sex. Well, do you even snuggle at night in the bed? Are you kidding me? I'm on the other side of the bed hoping he doesn't reach over, because then I'm going to have to tell him no, then he's going to be mad. But why would I tell him yes? Because it hurts. But
Yeah.
so I'll say, I'm sorry, go ahead.
No, it's so true. I mean, you're describing our situation, or as it was in the beginning, to a T. And I was that person. I shut the door completely because I was afraid to go there. And for me, and you kind of helped me out with this along the way. Communication is huge. Like, being honest with your spouse that it is painful and that you don't want to go there. It helps open the door so that you can have some of the other aspects of intimacy.
I love that. And again, I'll say, to a woman, like, here's some language, sex really hurts. I know that it's not going to hurt forever. Could this just be a time where I really need to hold you? I need you to hold me. I need us maybe even to have some intimate touch that doesn't turn into that. And, is that something that you can do? So when we couch it as a question, then it doesn't feel like an attack. Yes?
Yeah. Also, almost, having a safe word is something where once we open the doors of communication, and now I'm getting into all the details, but once my husband and I opened that communication, if it was too much for me, I had to know that it was okay for me to say, no, 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 this is too much. And he, is receptive to that.
Yep.
If I
And even
need,
to say cuddle day. This is just a cuddle day.
yes,
Just
yes.
to say that. And yeah, there might be some disappointment, but yet it's way better than, I have patients who, don't even go into the bed until he's asleep, and they set an alarm to get up before he wakes up. So they don't have to be in the bed when their husband's awake.
It's so
Sorry that
true.
you're laughing at that. But yeah, it's true, because again, it's like, well, maybe in the moment, it's the lesser of two evils.
Yeah, no, it becomes terrifying and consuming. I can relate to all of those things.
It's so sad. And again, one of the things I just reached for is the sex deck. So the sex deck is something that's available on the website. And this is something that I invented to help make this conversation easier. The sex deck has the 27 reasons for low sex drive. And, one is painful sex. And on the back is why painful sex might happen. And then what are the options to do about this? I wish every doctor or healthcare provider had this in their pocket. So if someone even mentions sex, it helps the provider become an instant sexual health expert with all the basics at their fingertips. This is all evidence-based. It's been looked at by all my sexual health colleagues across the country. And it's something that you can buy on the website, and you can have as a healthcare provider, you can have at your office. As a patient, it's wonderful to take into your provider and say, look, I have painful sex. I know that these are options. What might be safe for me? And then also, right, Tammy, to bring home to your partner to say, look, these are real. It's not your fault. It's not my fault. These are real. And so, and there are things that we can do about it. So it just takes the blame game away, right?
It does. Educating the spouse is important on both sides. It's
Yes.
important to educate the
So,
patient and the spouse.
and I tell you again, back to why we're here in the first place. I hope that this conversation would help. It would help women have hope, and help healthcare providers not be afraid of talking about the subject. And I tell you what just makes my day and makes me feel so, so blessed and fortunate is when I see women like yourself leave an appointment and have hope. There's nothing like it. So again, thank you so much for sharing your story. And I wish everyone a good night. I'm getting a little choked up. Like,
Yeah.
it's just such an important thing.
No, I think so too. Hope is huge.
Hope is huge. So I wish everyone a good night. If you have any questions, please feel free to contact us. We wish you all the health in the world, and we want you to live your truth. So be well, and thank you again.
Thank you for having me again.
Thanks, Tammy. Bye-bye, everyone.